There are the following borders of the neck region. The superior border passes through the inferior border of the mandible, the temporomandibular joint, the mastoid process, superior nuchal line, and the external occipital protuberance. The inferior border passes through the jugular notch, the clavicle, the acromion of the scapula, and the spinous process of the 7th cervical vertebra. There are several anatomical regions within the neck. The anterior cervical region, the lateral cervical region, the posterior cervical region, and the sternocleidomastoid region. Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description. The muscles of the neck are located within these anatomical areas. They are divided into superficial and deep muscles. The superficial muscles form 3 groups: the surface group, the infrahyoid group, and the suprahyoid group. The surface group includes the platysma muscle, the sternocleidomastoid muscle, and the trapezius muscle. The suprahyoid group includes the digastric muscle, the stylohyoid muscle, the mylohyoid muscle, and the geniohyoid muscle. The infrahyoid group includes the omohyoid muscle, the sternohyoid muscle, the sternothyroid muscle, and the thyrohyoid muscle. Let us examine each muscle in greater detail. The platysma muscle originates from the pectoral fascia in the region of the clavicle and the subcutaneous tissue in the region of the ribs 1 to 2. Inserts into the mesenteric fascia and it weaves into the muscles of the angle of the mouth. Function: the muscle stretches the skin of the neck. Also, it is classified as a fascial muscle. It lowers the angle of the mouth. The following structures innervate the muscle and supply it with blood. The sternocleidomastoid muscle. Origin: the sternal head arises from the manubrium of the sternum. The clavicular head arises from the sternal end of the clavicle. The lesser supraclavicular fossa is located between the heads. The muscle inserts into the mammillary process of the temporal bone, the lateral part of the superior nuchal line of the occipital bone. Function: with a bilateral contraction, it throws the head back, and with a unilateral contraction, it tilts the head to its own side and turns the face in the opposite direction. The following structures innervate the muscle and supply it with blood. The trapezius muscle. Origin: the descending part originates from the external occipital protuberance, the superior nuchal line, the spinous processes of the vertebrae, and the nuchal ligament. The transverse part originates from the spinous process of the 1st to 4th thoracic vertebrae. The ascending part originates from the spinous process of the 5th to 12th thoracic vertebrae. Insertion: the descending part inserts into the external third of the clavicle. The transverse part inserts into the acromion of the scapula and the spine of the scapula. The ascending part inserts into the spine of the scapula. Function: the descending part brings the scapula closer to the spine, superiorly and medially, helps to extend the cervical spine, and helps to turn the head to the contralateral side. The transverse part pulls the scapula medially, and the ascending part pulls the scapula inferiorly and medially. The following structures innervate the muscle and supply it with blood. The digastric muscle. Origin: the anterior belly arises from the digastric fossa of the mandible. The posterior belly arises from the mastoid notch of the temporal bone. Both bellies are connected by an intermediate tendon. The muscle inserts into the intermediate tendon, which inserts into the body and the greater horn of the hyoid bone. Function: with unilateral contraction, it lifts the hyoid bone. With a fixed hyoid bone, it lowers the mandible. With bilateral contraction, it pulls the hyoid bone posteriorly and superiorly. The following structures innervate the muscle and supply it with blood. The stylohyoid muscle originates from the styloid process and inserts into the body and the greater horn of the hyoid bone. Function: with unilateral contraction, it lifts the hyoid bone, and with bilateral contraction, it pulls the hyoid bone back and up. The following structures innervate the muscle and supply it with blood. The mylohyoid muscle originates from the mylohyoid line of the mandible and inserts into the body of the hyoid bone. Function: forms the oral diaphragm. With unilateral contraction, it lifts the hyoid bone, and with bilateral contraction, it pulls the hyoid bone back and up. The following structures innervate the muscle and supply it with blood. The geniohyoid muscle originates from the mental spine of the mandible and inserts into the body of the hyoid bone. Function: when the hyoid bone is fixed, it lowers the mandible. When the mandible is fixed, it lifts the hyoid bone. The following structures innervate the muscle and supply it with blood. The omohyoid muscle. Origin: the superior belly arises from the body of the hyoid bone. The inferior belly arises from the superior border of the scapula and the transverse scapular ligament. Insertion: both bellies are connected by an intermediate tendon. Function: pulls the hyoid bone down and posteriorly. When the hyoid bone is fixed, it pulls the pretracheal layer of the cervical fascia. The following structures innervate the muscle and supply it with blood. The sternothyroid muscle originates from the manubrium of the sternum and the cartilage of the first rib. Inserts into the oblique line of the thyroid cartilage of the larynx. The muscle lowers the larynx. The following structures innervate the muscle and supply it with blood. The sternohyoid muscle originates from the manubrium of the sternum, the posterior sternoclavicular ligament, and the sternal end of the clavicle. Inserts into the body of the hyoid bone. The muscle pulls the hyoid bone down. The following structures innervate the muscle and supply it with blood. The thyrohyoid muscle originates from the oblique line of the thyroid cartilage of the larynx and inserts into the body and the greater horn of the hyoid bone. The muscle lowers the hyoid bone, and with a fixed hyoid bone, it lifts the larynx. The following structures innervate the muscle and supply it with blood.